Hi, I'm Lauren Quinn. I'm the Vice President of External Relations at LifeGift. And today I'm here to talk to you about LifeGift, the regulatory environment that LifeGift works in, and advocacy efforts that you could be a part of. I'm excited to share this information with you, and I appreciate your time. Okay, let me just share my screen here. Okay, hopefully you are able to see my PowerPoint presentation. I can see it on this screen, so I'm going to kind of go back and forth in where I'm looking. Thank you for bearing with me. Okay, so to start, we're going to just kind of share a little bit of the fundamentals of organ procurement organizations and how the donation system is set up within the United States. So LifeGift is one of 58 organ procurement organizations across the country. All of, we call them OPOs as well. All of our OPOs are nonprofit organizations that have what we call federally designated donor service areas, or DSAs. We use a lot of acronyms in our field. Inside these DSAs are donor hospitals or hospitals that facilitate organ donation, as well as transplant programs. Here in Texas, we have 3 OPOs: LifeGift, Southwest Transplant Alliance, and Texas Organ Sharing Alliance. So we are served by 3 OPOs in the state of Texas. Most OPOs are independent, are freestanding nonprofit organizations, although there are about 7 across the country that are hospital-based, meaning that they are part of a hospital or hospital system. So this is just a map of the various donor service areas across the country. And from what you can see, they are really different depending on where you are in the United States. There are some OPOs that are very large and that cover an entire state or even several states. There are some OPOs that are very small. You know, generally they're regionally based, but it can look quite different depending where you are in the country. So now I'm going to talk a little bit about, you know, to make it sound fancy, the 3 estates of donation. These are really, you know, the 3 pillars that together to facilitate donation and transplantation in the United States. And we'll start with hospitals. And I'm going to kind of break down what role each entity has in facilitating donation. So hospitals, and you know, sometimes we'll refer to them as donor hospitals, which is really, you know, not a correct term. Any hospital that has the resources to facilitate organ donation could be a donor hospital. It simply means that a hospital that has the, you know, the staff, the resources to facilitate organ donation. So hospitals' responsibilities within the context of organ donation is to refer all deaths and patients meeting clinical criteria to the organ procurement organization in a timely manner. And the definition of timely is one that's created jointly by the hospital and the OPO. But they're required by Medicare to report all deaths and what they term imminent deaths to the OPO to evaluate for the potential for organ and tissue donation. Hospitals will then partner with OPOs to approach families who have the option to donate in a sensitive and supportive manner, and also work with the OPO to clinically manage donors after families or the donors have provided authorization for donation. So hospitals are really accountable for preserving that option for donation until the OPO can evaluate medical suitability for donation, and also has the opportunity to talk to the family, the next of kin, about that option. So organ procurement organizations like LifeGift have obviously, you know, several responsibilities in facilitating donation. We are responsible for responding to all potential organ donor referrals and for evaluating suitability for donation. OPOs are the entity tasked with determining whether or not a patient can be a potential organ donor. That falls on the OPOs. We are also what's called the lead designators in approaching about donation, meaning that we do that collaboratively with the family, but it's really our responsibility to have that interaction with the family. We work with the healthcare team to medically manage donors, like I mentioned before. And then we also work to allocate those organs for transplant and arrange for the logistics of the organ recovery. So transplant programs are responsible for the transplant end of it. They assess and either accept or decline organ offers for their patients who are waiting for a transplant. If they are accepting an organ for a patient, they will generally travel to the donor hospital for the organ recovery surgery. Transplant programs are evaluated by Medicare to determine if they are meeting CMS's expectations for patient outcomes following transplant. How successful have their transplants been? How well have their patients done following the transplant surgery? So, I talked about each one of these, estates sort of individually, but they are all really responsible for working together very closely and, very collaboratively to ensure that the donation process runs smoothly and that, transplants occur successfully. One cannot exist without the other. Okay, so this is a very nice graphic that kind of provides an overview of how donation is overseen across the United States. And I'm going to do everybody a favor and not go into detail on every element of this infographic, but I wanted to, impress upon everyone listening to this that, organ donation and transplantation is one of the most highly regulated elements of healthcare. It is a very closely managed system in the United States, as it should be. We've got over 100,000 people waiting for a transplant, and obviously the need for donor organs right now is not or is exceeding the availability of organs for transplant. So this should be a highly regulated system, and we're happy that it is. I am going to highlight a couple of things on this infographic. UNOS, which many of you are maybe familiar with, the United Network for Organ Sharing, they manage the the waiting list for patients waiting for a transplant and are responsible for that allocation component along with OPOs. They are matching organs available for transplant with patients in need of transplants. But UNOS is really it is an organization that has is facilitating the allocation and the waiting list on behalf of the OPTN, the Organ Procurement and Transplantation Network, which really kind of oversees donation and transplant in the United States. You may have also heard of the FDA. Of course, that's an organization that touches many elements of our lives. As it regards, organ and tissue donation, it oversees tissue donation in the United States. So I just wanted to highlight that because so many people are familiar with the name, but we're not really going to talk much further about that in this presentation. What we are going to spend a lot of time talking about is CMS, or as many people know it as Medicare, which does survey and oversee organ procurement organizations, and we're going to talk a little bit more about that process in detail in the upcoming slides. Okay, so CMS, or Medicare's oversight of OPOs. What exactly does that mean? So all OPOs are certified by CMS, and that's how they sort of retain that donor service area that we talked about earlier. And in being recertified by CMS means that you are, the organ procurement organization is either meeting or exceeding what CMS standards or conditions of participation for OPOs. So to be in good standing with CMS, an OPO needs to meet all of those standards. And all of those standards are laid out in a document that's called the final rule. CMS sort of has its own language that we follow. So these standards measure OPO processes as well as outcome measures. CMS wants to make sure, since there's only one organ procurement organization that serves any particular region, because you don't want to have competition for organ donation, of course. So there's only one, that's what we mean by federally designated. But because there's only one, CMS has a responsibility to ensure that that OPO is doing everything that it can to maximize donation in the area that it serves, that it is a high-performing organization. So these surveys by CMS are, they occur every 4 years, although certainly CMS has every right to do an investigation of an OPO if a complaint is made or there is some process deviation that requires further review. And at the end of the day, CMS has the authority to decertify an OPO if the OPO is not meeting standards or has violated some process, egregious enough that CMS feels that's a step that it needs to take. So, the landscape has changed a little bit over the last year in terms of, the regulatory landscape. So I'm going to talk a little bit about that over the next couple of slides. So back in December, the Trump administration came out with an executive order that was focused on kidney donation and transplant, but also talked about or impacts OPO performance. So the bullets on this slide go through the different elements of the executive order. So what the order does or what the order charges is for the Secretary of Health and Human Services, Secretary Azar, to do the following. Remove disincentives for living kidney donation, meaning, what can the government do to ensure that someone who is a living kidney donor is not suffering any financial disincentives by being a kidney donor. It also charges the secretary to develop an awareness initiative on kidney and related diseases, kidney diseases and related diseases. It charges the secretary to develop payment methods to fund innovative kidney care services, focusing on home dialysis and treatment of at-risk populations. There's certainly certain ethnic populations that are at a higher risk of kidney disease. It charges the secretary to develop a framework for the development of an artificial kidney. And of course, that doesn't mean that the secretary is going to have invented an artificial kidney over the next year. This is sort of just a compilation of charges that the Trump administration is giving to the secretary to kind of start the groundwork on. And then the last thing that we're going to focus on is changes or revisions to the OPO outcome measures, which again are sort of the data metrics that the government uses to determine whether or not an OPO is meeting its standards for performance. So what are those proposed outcome measures? And here's where we're going to get a little bit wonky and in the weeds, and I hope you bear with me as I kind of go through an explanation, because I think it's important to provide a framework on this as we're talking about advocacy efforts afterwards. So there are 4 proposed outcome measures which would replace the current measures by which CMS is evaluating OPO performance. So these measures include the donation rate measure, the transplantation rate measure, the top 25 benchmark measure, and moving reviews of OPO performance from 4-year survey cycles to 12-month blocks of time within that 4-year cycle. So I'm going to talk a little bit more about each measure going forward. But before I start that, I want to kind of lay out LifeGift's position and also philosophy to these changes. First and foremost, LifeGift is a really high performing OPO. We meet the outcome measures as they are currently in place, and we will meet the outcome measures as they are currently proposed. So LifeGift is not at risk of decertification or any punitive measures under the measures that are currently evaluated and the measures that are currently proposed. We are very open to regulatory oversight, as I talked about before, and we welcome any tools or resources that allow us to, to evaluate our performance and ensure that we are continually performing. We have a life-saving mission that we take very seriously, and we have a responsibility to our donor families, to our hospitals, and to the patients waiting for a life-saving organ transplant to ensure that we are relentless about performance improvement because lives depend on us. And lastly, we recognize that the outcome measures that have been in place for a very long time do need to be updated to, provide the best measurement of OPO performance. The current proposed standards, we have some concerns with, and I'll talk a little bit more about those. Okay, so let's get into what these measurements actually mean. I've thrown a lot of verbiage at you. What exactly are those definitions? So the donation rate measures the number of actual donors in an OPO service area. So the number of actual donors over the number of potential donors. How many patients that died met the medical criteria to be a potential organ donor, and of that pool, how many of them went on to actually be donors. The transplantation rate measures the number of organ donors as a percentage of donor potential. So if you think about elementary school math, the first measurement, the donation rate, is number of donors over number of potential donors. The second rate, the transplantation rate, is number of transplanted organs over number of potential donors. And I think it's important to note, that not every death that occurs allows for the potential of organ donation. In fact, very few deaths, about 1 to 3% at any hospital, depending on the hospital, dies in a way that allows for the opportunity of organ donation. And so how does the regulatory agency, how does CMS determine who is a potential donor? Well, the way that they propose it in these new regulations is to look at death certificates. What is the cause of death, and was that cause of death, an opportunity for donation? Did the patient die in a manner that allows for the opportunity of donation? So, we and as many of our colleagues across the country have shared concerns about using death certificates as a way to determine donor potential, because research has shown that death certificates are filled out erroneously a fair amount of time, anywhere from 30 to 60%, depending where you are in the country. And we've seen that during the coronavirus times, that someone may have died of a COVID-19, but their death certificate lists pneumonia or multi-system organ failure. And so, we see that quite frequently, that death certificates are not the most accurate measure of, or not the most accurate communicator of how a patient died. And if OPOs are to be measured for their performance, which they certainly should be, we just want to make sure that that denominator is accurate, that, that CMS is measuring an OPO's performance based off of an accurate definition of donor potential. The second concern that we have with these proposed outcomes is they're sort of measuring the same thing, because they have the same denominator, which is potential donors. So, the number of donors and the number of organs transplanted is still being measured against the same denominator, which is sort of two different ways of looking at the same thing. So what is our outcome, or our LifeGift's recommendation for these two outcome measures? The first is to replace death certificates as the source of donor potential. Right now, hospitals already report to CMS information about inpatient deaths, and using codes called ICD-9 and ICD-10 codes. They're billing codes, but they're tied to the ways that people have unfortunately passed. So utilization that's of information that's already being provided by the hospitals to CMS, we think, is a more accurate way to determine the donor potential at any given hospital. In regards to our concern about the two proposed measures measuring the same thing, we are suggesting that they replace the proposed transplantation measure with a metric that's already in use in our field, what we call the observed versus expected metric, which is a metric that uses a very complicated algorithm to determine, how many organs transplanted a service area, an OPO, should have based on how many they actually do have. So the long and short of that is, it's a metric that's already being used by our industry, by our field, and has already been validated, and would be a better assessment of performance than the current proposed outcome measures. So the top 25% benchmark, what this is about is that CMS is proposing that of the 58 OPOs across the country, that all OPOs meet the donation and transplantation rates of the current top 25% of OPOs. So if you put all of the data of all 58 OPOs on the board and you looked at who are the top 25% performing OPOs, according to the donation and transplantation rate, that all OPOs should be performing at that level or risk decertification. As an organization that would be in that top 25%, we still have concerns about this particular measure. One, because it's a bit arbitrary. The proposed regulations don't really provide any clinical evidence to support that threshold, and in fact, it's not a threshold that's used in other healthcare metrics. So we don't really see the clinical evidence to support implementing a 25% threshold. And along those lines, the proposed regulations also do not provide a pathway for OPOs to improve their performance. So if an OPO is not meeting the threshold, there's no language in the current proposed regulations that allow for the OPO to enter a performance improvement plan. And this is something that regularly happens if a hospital isn't meeting a healthcare outcome measure, or if a transplant program isn't. There's an opportunity for that entity to work with CMS to put a performance improvement plan into place, as opposed to an OPO just becoming decertified, which may cause disruptions to the donation system. So, we in our comments back to the to CMS on the proposed regulations suggested implementing a process improvement or performance improvement plan for any OPOs that don't meet the outcome measures. So, I've talked a little bit about the metrics, and now I really want to talk a little bit about what happens next. So these metrics came out, these proposed outcome measures were shared by CMS at the end of last year. And there's always a period of time when CMS puts out proposed regulations that they invite individuals and entities to provide what's called public comments, feedback on what the proposed regulations are. These are the things that look good. These are things that we have concerns about, and anybody can submit a public comment. A person with a personal interest in donation, an OPO, a transplant program, and there were quite a bit of public comments that were submitted on these proposed regulations to CMS. So the period for submitting comments has unfortunately closed. I think it was back in February of this past year. And so now we're at a point where CMS reviews all of the comments that were submitted by different stakeholders and by people across the country, and determines whether or not, based on that feedback, they should make any changes to their proposed regulations before they finalize them. That is kind of where we are in the finalization of the proposed outcome measures. What we have seen during this waiting period is that we have seen advocacy efforts from special interest groups from the outside of the donation community, really advocating for CMS to finalize these regulations. And the slide says prior to the election, because I wrote it prior to the election, and I'm giving this talk on November 4th, the day after the election, where we still don't actually know, as of today, who the next president will be. But obviously, as an administration changes, priorities change in different departments. So there was a push to get these regulations finalized as proposed, whether or not there would be any change come January 21st. But, as a result of these efforts, we have seen a lot of scrutiny of OPO performance and, some negative implications in the media. And we've also seen advocacy or, lobbying efforts directed at elected officials and the Secretary of HHS to get these regulations finalized. As I mentioned before, LifeGift has really kept our messaging very clear. We are not opposed to change in oversight or in our outcome measures. We just want to make sure that those changes are thoughtful, that they're deliberative, that they don't disrupt the donation system, and that they will result in more organs being transplanted and more patients being taken off the waiting list because they've been transplanted, and an increase in donation. So how can our ambassadors of hope, how can our volunteers support these efforts? To start off with, you do not need to be an expert, subject matter expert in donation and transplant. I know I threw a lot of statistical explanations at you a few slides ago. You do not need to retain that information. I think your personal connection to donation and transplantation gives you a very powerful voice in our community, certainly with our elected officials that represent you, either statewide or federal wide. And you can certainly use your voice to join the thousands of people across the country that have already participated in some advocacy efforts around around the outcome measures and around these proposed regulations. So what are different ways that you can help? You can certainly do, again, what thousands of other volunteers across the country at different OPOs have done, is contacting your elected officials and asking them to support OPOs by, opposing the finalization of these measures in their current form. And I keep emphasizing that because I want to make sure that everybody understands that we are not opposed to changing the regulations and updating the outcome measures. We just have some very specific concerns with how they are currently written. When we were a little afraid of some unintended consequences of those. So how does outreach happen? You can do it via an email, a formal letter, or a phone call. And we certainly have a lot of resources that we can share with you to do these things, whatever way you choose to do them. You can also make a video of support. That's something that we've been working with some of our ambassadors on. And this is not anything fancy, with Hollywood cameras. We are talking about, an iPhone and a brief, 1 to 2 minute video, just talking about your personal connection to donation and, why you are, supporting LifeGift's advocacy efforts. These are videos that we are sharing on our social media platforms and certainly with select elected officials that we have a relationship with. And you will also see, if you follow us on Facebook or Twitter or Instagram, from time to time, we have shared some social media posts about this, about these proposed regulations and our concerns with them. So if you see those and you are active on social media and are willing to retweet or repost them using our hashtags, that just amplifies our voices in the social media sphere. And our two hashtags are support OPOs and hashtag Save More Lives. So a very easy way to add your voice to our, to our collective society without having to do much more than clicking on a couple buttons on your computer. Okay, and these are just two examples of some posts that we had put up on Facebook. One was actually a reposting of an article written by a donor mom and hospital executive who is also on LifeGift's board of directors, who talked a little bit about her story and why she's concerned about these proposed regulations. And the second was a retweet or a repost of an article by a transplant surgeon who shared similar concerns. So we have some resources that are really accessible to you if you want to learn more or if you do want to participate. Our website has an advocacy page under a drop-down for organ and tissue donation. If you go to that drop-down, there is an advocacy page right there. That's got fact sheets. That's got templates that you can use if you wanted to craft a letter or an email. It's got infographics that you can share on social media. Our professional association also has a really great site that allows you to easily search for who your elected officials are if you're not quite sure, and also provides talking points that you can use. And of course, last but not least, our friendly and informative LifeGift staff, our communications team is always willing to help support your efforts in any way that you need. And we are always available to call or email or schedule some time with. So that is concludes my presentation. I hope that this was an informative and helpful to you, and I certainly appreciate your time that you've taken to learn a little bit more about this element of organ donation, which we don't talk about a whole lot. And again, appreciate all of our Ambassadors of Hope's efforts on our behalf, and look forward to seeing you again face to face, hopefully sometime soon. Take care.